Moving a patient up in bed. Good day, learners. This presentation will deal with assisting a patient to move up in bed and will assist in your preparation for assessment. Patients can slide down in the bed due to excessive movement or the inability to move themselves. This can be extremely uncomfortable for the patient and may cause injuries to the feet and toes. Care providers must take care when moving a patient to prevent injury to the patient. The use of correct body mechanisms will assist in reducing the risk of injury to oneself during the procedure. Purpose: moving a patient up in bed is a generic basic nursing care standard to be mastered by all learners. Learners skilled in this standard will be able to promote patient comfort. Specific outcomes. Learners who have been assessed and found competent in the moving of a patient up in bed will have achieved the following outcomes and will be able to apply the correct body mechanisms throughout the procedure, perform the procedure without injury to the patient or to oneself, and record and report any abnormalities correctly. Embedded knowledge. Embedded knowledge represents what you as a learner has to understand and be able to explain in an area of learning and at a particular level. You as a learner should have mastered all the theory related to patient activity and mobility. You should have sound knowledge related to the anatomy and physiology of the musculoskeletal system. You should also have sound knowledge about back safety. You should understand the medical legal aspects regarding the safety of a patient. And lastly but not least, you as a learner should have attended a demonstration in simulation on how to move a patient up in bed. Range statement. Moving a patient up in bed is a generic basic nursing care standard and learners can be assessed in the field of learning in line with subject matter expertise. Procedure. This procedure will be performed according to the nursing process. Assessment. Identify the patient. Greet the patient and introduce yourself. Ask the patient to state his or her name. Check the patient's name and identification number on the patient's identification bracelet. Compare the patient information with the patient records. If the patient cannot identify him or herself, verify the patient's identification with a second staff member who knows the patient as a second source. Explain the procedure to the patient and obtain the patient's permission. Check the medical records and nursing care plan for conditions that may influence the patient's ability to move or to be repositioned. Appropriate nursing diagnosis may include the following: impaired bed mobility, risk for injury, impaired skin integrity, acute pain, confused mental state, and activity intolerance. Assess for any medical equipment or surgical procedures that may alter the positioning procedure. These may include the following: intravenous lines, drainage tubes, oxygen therapy, incisions or wounds, or the presence of a cast. Assess the patient's ability to assist you during the procedure and identify any movement limitations, for example body mass, mental status, and physical conditions. Planning. Assemble the following equipment: a clean draw sheet and clean gloves. Sometimes you may find it difficult to move certain patients due to movement limitations, so arrange with an additional care provider to assist you with this procedure. Prepare the environment by closing the curtains around the bed and closing the door to the room if possible. Implementation. Perform social hand hygiene. Adjust the level of the bed to an appropriate and comfortable working height. The second care provider should be positioned on the opposite side of the bed. Adjust the head of the bed to a flat position or as low as the patient is able to tolerate. Put on clean gloves if expected to touch bodily fluids. Remove all pillows from under and around the patient. Leave one pillow at the head of the bed, leaning upright against the headboard. This will ensure the patient does not injure him or herself when moved. Stand next to the patient in line with the patient's midsection. Open the top linen by folding it to the foot end of the bed. If a draw sheet is not in place under the patient, place one under the patient's midsection. Ask the patient to fold their arms across their chest. Spread your feet so that they are shoulder width apart, with your foot closest to the head of the bed slightly in front of the other, and turn towards the head of the bed. Fan fold or roll the draw sheet as close to the patient's body and grasp it securely. Ask the patient to pull up their legs, with their feet flat on the bed, and to lift their head with their chin on their chest. Flex your knees and hips. Tighten your abdominal and gluteal muscles and keep your back straight. You will shift your weight from your back leg to your front leg as you move the patient up in bed. Both care providers should move simultaneously. If possible, the patient can assist with the move by pushing with their legs. Repeat this process if necessary to get the patient in the right position. Tidy the bed linen and ensure that it is crease-free. Cover the patient by pulling the top linen over the patient. Elevate the head of the bed as required. Assist the patient to a comfortable position and adjust the pillows. Raise the side rails if required. Thank the patient and the other care provider for their assistance with the procedure. Remove your gloves if any were used and discard it according to the internal policy of the facility. Perform social hand hygiene. Lower the level of the bed. Place the core bell and other necessary items within the patient's reach. Evaluation. The expected outcomes are met when the patient is moved up in bed without injury to the patient or oneself, and if the patient is comfortable and maintains a proper body alignment. Record keeping. Record and report any abnormal findings during the procedure. Special considerations. In some cases, more care providers are required to assist with moving of a patient. Let's look at some of these examples. When moving a patient with a leg or foot problem, such as a cast, wound or fracture, one extra care provider should be assigned to lift and move that extremity. When the patient is unable to assist or the patient is too heavy to be moved by two people, assistance should be given by at least two more care providers. Thus, having care providers at both shoulders and the hips on either side of the patient. In cases where the patient receives oxygen therapy or has an intravenous line, a drainage tube or urinary catheter in place, great care should be taken during the procedure to prevent pulling on or dislodging of the tubing, which may cause injury to the patient. The drainage tube should be temporarily clamped to prevent backflow of fluid. Move any tubing, lines and collection bags with the patient during the procedure. Remember to unclamp the tube after completing the procedure. In conclusion, the caregiver plays an important role in providing comfort for the patient. Adherence to infection control guidelines is important to ensure that all care is safe care. Perform your task as per this lecture and to the best of your ability, always keeping in mind your scope of practice.